IAP Advanced Life Support course is flagship program of Indian Academy of Pediatrics. The IAP BLS module is brief and is in easy to follow steps. We have incorporated not only the knowledge but also the most effective way to retain the BLS skill, that is practice while watching videos, PWW.
1, 2, 3, 4, 5.
Each step of BLS like assessment, calling for help, breathing, chest compressions and use of AED is supposed to be executed in a defined way and a sequence. Each step has to be performed within a time frame to ensure the CPR is high quality and effective. The risk of contracting communicable illness from a victim during mouth-to-mouth breathing is extremely small and should not deter from providing help when needed.
2, 3, 4, 5.
Yeah, there is no better game than cricket, yeah.
Yes, you are right. But now I am feeling hungry, so let's go for the lunch. Yeah, let's go. Oh no, I am not.
What happened? What happened? What happened? Salandra, what happened? What happened, Salandra? What should I do now? Salandra, what happened? Salandra.
God, please help me.
What happened?
Please see.
Let's take him to hospital. Come on, fast.
Please continue high quality chest compressions.
Are you Shailen's brother?
No man, I'm his friend. His brother and other family members are on the way.
Okay. Actually, I had to inform you that when Shailendra came, his condition was not good. He was in a very serious situation. His heart was not beating. He was very serious and very critical. Our team tried their best, but we could not save him. We are really sorry.
Oh God, what else I could have done to save my friend's Salandra life?
Congratulations to you for making a decision to effectively help someone survive a sudden cardiac arrest. This could be anyone who could be indebted to you for life if you are able to provide help when it mattered the most. Sudden cardiac arrest can happen to any person, anywhere, at any time. Majority of cardiac arrests occur at home and witnessed in 85% of cases. Time to treatment is critical when considering the chances of survival for a sudden cardiac arrest victim. 95% of those who experience sudden cardiac arrest die because they do not receive life-saving CPR and defibrillation within 4 to 6 minutes before brain death starts to occur. In India, most people do not know how to respond when someone collapses suddenly. Every minute delay in CPR would decrease the survival by 17%. Sudden cardiac arrest is sudden cessation or stopping of effective heartbeat. The cessation of blood supply to the brain results in unresponsiveness. The heart may either stop completely or the electrical activity may be in disarray, that is rhythm abnormality. In these situations, though temporary, but the only mode available to maintain the flow of blood to brain and heart is cardiopulmonary resuscitation till either the electrical activity of the heart is corrected by AED or advanced care is available.
Shock delivered.
In this course, you would acquire the skill of providing basic life support for an adult, child and infant cardiac arrest situations. You would also learn to provide help to an adult as well as child and infant victim of complete airway obstruction secondary to foreign body inhalation, which is again a condition where the person standing next to victim is the most helpful one to save the life.
Oh no, I am not.
What happened? What happened? What happened? I'm calling 112. Hello? My friend has collapsed in Vrindavan Colony playground. Please come. What happened? What happened? Salendra? What happened?
Coming through. Please stand back, sir. We'll take care of him. Hey, are you listening to me? Can you hear me? He's not responding. He's not breathing. There's no pulse. Start CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. AD is analyzing rhythm. Let's switch positions. AD has advised shock. Stay clear.
Clear.
Shock delivered. Resume CPR.
1.
AD is analyzing rhythm. AD has not advised shock.
There is pulse. He's breathing.
Let's shift him to the ambulance.
Are you Shailen's brother?
No, ma'am. I'm his friend. His brother and other family members are on the way.
Okay. Congratulations, we could revive him.
Thank you, ma'am.
Actually, he had a cardiac arrest and he was very critical when he came. But your chest compressions and your timely interventions saved his life.
Thank you, ma'am. Thanks a lot for saving my friend's life. Thanks a lot, ma'am.
People around the victim may be recruited for out of the hospital setting. This is known as activating the emergency response. Before helping any victim, first ensure that the scene is safe. Remember, you cannot save a life if you become a victim yourself. Now, let us learn how to assess a victim safely and effectively. A victim is in cardiac arrest if he or she suddenly becomes unconscious and unresponsive, has no signs of life, that is, no movement, no normal breathing, no response to touch or voice, and no signs of circulation or purposeful activity. In cardiac arrest, there is no pulse. Pulse check is for healthcare professionals. Lay rescuers should begin CPR without delay.
1, 2, 3, 4.
The next step is to assess the victim for response and breathing. If you are the lone rescuer, then you should immediately call for help and get AED. Assess the victim for a response.
Hey, are you listening to me?
And if there is no response, shout loudly for a nearby help or activate the emergency response system using mobile device if appropriate, or send someone to get an AED or defibrillator and emergency equipment.
Somebody please activate the emergency response system and get an AED.
This has different meaning in different situations. For example, if a victim has cardiac arrest within a healthcare facility, you are going to call for the code blue team or rapid response team. If you are outside the healthcare facility, you can call nearby ambulance service or nearby hospital. In some states in India, there is a number to call for emergency response, example 112 or 108. If there is no breathing or no normal breathing, begin high quality CPR with cycles of chest compressions and breaths in 30:2 ratio, starting with chest compressions using the CAB sequence.
Performing chest compressions correctly is very important, as this will ensure at least 20 to 30% of blood flow. In this video, we are going to learn chest compressions.
Make sure that the victim is lying in a supine position on a firm, flat surface. While performing CPR, you must have a clear visible view of the chest. You should position yourself by the side of the victim. Remove any clothing so that the bare chest is clearly visible. Put the heel of one hand at the center of the bare chest over the lower half of the breastbone. Then put the heel of the other hand on the top of the first. Make sure Your shoulders are exactly above your hands and your elbows must be straight and locked. Push hard and fast. Avoid pressing directly over the zippy sternum as it can lead to serious injury. Press down at least 2 inches or 5 centimeter with each compression and deliver the compressions in a smooth fashion at a rate of 100 to 120 compressions per minute. Make sure that the chest recoils completely back after each compression. The time for chest compression and chest recoil must be approximately equal. After positioning the victim on a firm surface with your shoulders directly over the chest, press straight down. While doing so, your arms should be kept straight and elbows locked. If you bend your elbows, you will fatigue your arm muscles more quickly. Compressions should be regular and smooth, giving same time for compression as well as relaxation. Be sure the heel of the hand is in contact with the chest wall at all times. Compress and release in a steady rhythm. Be sure to keep your fingers off the chest. Massaging or pressing on the chest with the fingers in contact with the chest wall may cause rib injury. One more error is rocking chair technique, where compressions are done from side instead of straight down. Bouncing compressions are not very effective and can cause internal organ injuries. If you keep your hand crossed, it will make it more difficult to apply the right pressure. If you do not bring your shoulders above the hand and stay in sitting position, the chest compression will remain ineffective.
So let us summarize most common mistakes which we must avoid during chest compressions.
Don't be a rocking rescuer. Avoid bouncing. Avoid bending. Avoid double cross technique. Avoid massaging and don't be a sitter.
Friends, in this video, we will learn the technique of opening airway and giving breath. The correct technique is very important as this is done to keep the tongue out of the way so that the delivery of breath is effective. Both the steps of opening airway and giving breath must be done quickly and should not take more than 10 seconds, otherwise the chest compression will be interrupted. So let us look at the steps of opening airway and giving breath.
As per the new CAB guidelines, start chest compressions first and after 30 chest compressions, you are supposed to open the airway and give few breaths. To open the airway, follow these steps. Put one hand on the forehead and fingers of the other hand on the bony part of the chin. You must avoid pressing into the soft part of the neck or under the chin because this might block the airway. Tilting the head should be performed by gently pushing the forehead back and not by pressing the bony part of the chin. The finger on the bony part is used to lift the chin forward so that the tongue moves forward and gets out of the airway. While holding the airway open, pinch the nose with your thumb and forefinger. Take a normal breath and cover the victim's mouth with your mouth and give 2 breaths. Remember, you don't have to take a deep breath. Just take a normal breath and give the rescue breath. Blow for 1 second each. While giving a rescue breath, you should constantly see the chest to make sure the chest is rising adequately. After giving breaths, go back to your position for chest compressions. Remember, all these steps should be done quickly, taking no more than 10 seconds so that you can avoid interruptions of the chest compressions.
Barrier devices like pocket masks should be used if available.
For children aged 1 year until the onset of puberty, CPR technique depends on the child's size. Use one hand for chest compressions when appropriate or 2 hands if needed. Deliver chest compressions and breaths in a ratio of 15:2. After the onset of puberty, perform adult CPR ratio, that is 30:2. For the purpose of BLS sequence, the term infant means less than 1 year of age, excluding newly born babies in the delivery room.
In this clip, we will show you the CPR sequence. Assess for scene safety.
The scene is safe.
Assess the victim for a response.
She is unresponsive.
And if there is no response, shout loudly for a nearby help.
Somebody please activate the emergency response and get an AED.
Or send someone to get an AED or defibrillator and emergency equipment. Look for normal breathing to determine the next appropriate action. If no normal breathing within 10 seconds, begin high quality CPR in 15:2 ratio.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1 and 2.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
1 and 2.
Use AED or defibrillator as soon as it is available. If shockable rhythm, give one shock and resume CPR immediately for 2 minutes till prompted by the AED for next rhythm check. In an infant, because of the small size of chest, the thumbs may overlap during compressions. In case of an infant, the rescuer can switch roles after every 10 cycles of CPR to prevent fatigue.
Unlike adults, infants usually do not have heart-related problems leading to cardiac arrest. More commonly, infants and children have problems related to breathing leading to cardiac arrest. Thus, in infants and children, opening the airway and delivering breath is as important as giving a high-quality chest compression. Infants do not require large amount of air to get their lungs full. If the chest rise is adequate, it will ensure that enough air has entered into the lungs.
When food or other item blocks the person's airway, choking occurs. You may see the universal choking sign where a child or an adult may clutch their throat with both hands. In scenarios where there is severe airway obstructions, the victims will have signs of poor air exchange and breathing difficulty, such as silent cough, cyanosis or turning blue, and inability to speak or breathe. If you find any of these signs, you should immediately ask if the victim is choking.
Are you choking?
If the victim is not able to talk and nods his head, then you must act immediately.
If the victim has severe choking, stand slightly behind and to one side of the victim. Support the chest with one hand and lean the victim forward. Deliver 5 firm back blows with the heel of your other hand between the shoulder blades. Check after each blow to see if the object is expelled. If the airway remains blocked, give 5 abdominal thrusts using Heimlich's maneuver.
Stand or kneel behind the victim and place your arms around the victim's waist. With one hand, locate the navel. Then make a fist with the other hand and place the thumb side of the fist against the victim's abdomen just above the navel and below the breastbone. Grasp your fist with your other hand and press your fist against the victim's abdomen with quick and upward thrust. Repeat the thrust until the object is expelled from the airway or the victim becomes unresponsive. If the victim is too large to wrap your arms around the waist or is pregnant or overweight, then wrap your arms around the chest and do chest thrust instead of abdominal thrust. Even after doing the Heimlich's maneuver, if the victim shows no improvement or becomes unresponsive, then send someone to activate the emergency response system. Perform CPR using CAB sequence, but be sure each time you open the airway to give breath, look for the obstructing object at the back of the throat.
We have seen choking in adult and older child. Now we shall see choking in an infant, although the basic principle remains the same. The steps to relieve an infant from choking differs from an adult. If you find an infant with severe choking, you should sit or kneel with the infant on your lap. Hold the infant's face down with the head slightly lower than the chest, resting on your forearm. Support the head and jaw with your hands. Remember that while doing so, you should avoid compressing the soft tissue of the infant's throat. Rest your forearm on your thigh to provide support. Deliver up to 5 back slaps between the infant's shoulder blades using the heel of your hand. Deliver each slap with sufficient force so as to remove the foreign body. Then place your free hands on the infant's back, supporting the head with the palm of your hand. This will prevent the infant from falling off and also act as a support for the head and the neck. Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts just below the nipple line over the lower half of the breastbone. This should be done at a rate of 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or if the infant is found unresponsive. When your maneuver is unsuccessful or if the victim becomes unresponsive, then shout for help. Lay the infant on a hard, flat surface and start CPR. When you give chest compressions, an object may come out of the throat or you may be able to see the object. So, remember that each time you open the airway to give breaths, you should look for the obstructing objects at the back of the throat. If you can see the object, then perform a finger sweep to remove it. You should never perform a blind finger sweep.